Hello, I'm Dr. Holds and welcome to the practice. I'd like to discuss the topic of brow lift surgery. I see many patients who, through aging, have developed some sagging of the eyebrows. Many of these patients come in complaining of saggy upper lids, and their saggy upper lid is really a result of brow ptosis or a sagging eyebrow. And this is a common age-related change. I find in almost all folks as they age past age 40, the temporal part of your eyebrow tends to sag a fair bit. The inner part or head of the brow close to your nose really tends to change very little in position in most people as they age. A temporal brow ptosis is a common and normal aging change, and correcting this may be an important part of correcting a sagging upper eyelid. Patients I see for sagging eyebrows, in some cases this can actually be repaired on a medically necessary basis because it contributes so much to sagging of the eyelid over the pupil that it obstructs vision, and the repair is medically indicated. Many of the patients, however, wish to pursue this on a cosmetic basis. On a medical basis, I can do a relatively simple technique such as a direct brow lift with an incision immediately above the eyebrow. The direct brow lift is a very nice adjunct or additional procedure in many patients who undergo blepharoplasty surgery. It is relatively technically straightforward to perform, and if we keep the incision very short, the small scar above the eyebrow tends to be well hidden and, once healed, very hard to find. Patients who wish to undergo a more comprehensive correction of brow ptosis may wish to undergo one of the cosmetic techniques, such as a pretracheal or endoscopic brow lift. An endoscopic brow lift, which is a technique that I think works wonderfully for a more comprehensive correction of forehead sagging, excess muscle tone, wrinkling, entails typically making 5 short incisions in the scalp and essentially freeing up the entire forehead. So all of the muscles and retaining tissues are freed up, and using this technique you can lift the entire forehead. A big difference between this technique and a direct brow lift, however. For this technique, it would always be done in the operating room, typically under a general type anesthetic where you're put completely to sleep, and certainly involves a good bit more time, work, recovery, and a bit of risk compared to a direct brow lift. No surgery is without risks, and for endoscopic brow lift, typical risks could include hair loss, which I've never seen to any significant degree in a patient I've operated on, but is always possible. Most people do have some forehead and scalp numbness, at least for a time after surgery, and it's possible to get bleeding or muscle dysfunction, which could be a real problem. I've never encountered these in patients I've treated, but these are certainly risks that you need to be aware of. So shortly we'll be able to discuss any of your concerns and help decide what approach you think will be best for you.